Warm greetings, welcome, dear audience. Here we are again, back after a week of break, and with another sustainable development goal forum today with our uh, eminent academic speaker and an expert in pharmaceutical industry with our new topic that is artificial intelligence in healthcare. So this is the area of expertise for our professor, Dr. Nitish Kumar Jain from India. I'll give brief intro about him because he's not somebody new on our platform. He is an academician, a researcher, international academic speaker, a professor and head of department at Pharmacology, Modern Institute of Pharmaceutical Science, Indore, India. So without much ado, let's welcome Professor Dr. Nitish Kumar Jain. And to take over this session, I will invite our project leader and our team advisor, um, Dr. Anjum Qureshi. Welcome, Doctor.
Thank
Welcome, Dr.
you.
Anjum and Dr. Nitish.
Thank you very much, Dr. Esther. Greetings to everyone, to all the lovely audience who are watching us. And I welcome our esteemed panelist, Dr. Nitesh Jain, for this wonderful discussion, and also our founder and chairperson, Dr. Esther Mala. And today we'll be discussing on the topic artificial intelligence in healthcare. Can we have the slides, please? And as we know, when we talk about artificial intelligence, it has been discussed in nearly in every field. Whether we talk about education, we talk about and anything else, even when we talk about research, and also in healthcare, because AI is a smart technology that uh, that makes use of devices, the internet, the connectivity to the cloud, and more modern functionalities that they previously did not have. And a few examples of the smart technology in healthcare, one of them we can say like the smart beds that can track patient movements and alert the nurses when a patient leaves the bed, or an inventory uh, management system powered by AI that can track and monitor inventory and then automatically order new supplies when necessary. So when we talk about AI, we know that the AI and the related advancements are progressively playing the role of a disruptor in business and society. And the application of AI is also increasing in the healthcare domain. And that is what we will be discussing now. And we know that the advances that we are seeing in this healthcare, they can possibly change numerous parts of patient care, just as regulatory procedures inside supplier, patient experience, and pathology labs. And there are of now various researchers recommending that AI can proceed just as or better than people at key human services. So let's start with our discussion. So, sir, my first question for you is, how does AI personalize healthcare?
So first of all, very good evening to one and all, and welcome once again for the beautiful world. And I'm very special thanks to Dr. Easter Mala ma'am and Dr. Anjum Qureshi for giving this wonderful opportunities. And really, this is a very good initiative. As always, I told both of you are taking a great initiative for making world with well-known, renowned education system. So today we are here for artificial intelligence in healthcare system. So I would like to let and have the artificial intelligence play a major role in, especially in all kind of healthcare system and healthcare industries also. So basically, if we talk about the artificial intelligence in healthcare system, so now overall world we are seeing many disease and disorders day by day. It's coming in a new era, right? So the population is very high, so it's very difficult to manage healthcare system all over the world. If we talk about the safety, integrity, and the quality medicines, worldwide. If you're looking for a great research and all over the research and development in all the sectors related to healthcare system, so artificial intelligence definitely playing a major role, especially in pharma and healthcare industries. As I am the man from the pharma, so we are very much connected. If we talk about the healthcare industry, so is include definitely your pharmacy officers, doctors, nurses, many technicians, right, or many what we get the radiologists. So there are many healthcare professionals involved in healthcare industries. So if we want to connect all the healthcare professionals, especially, so artificial intelligence can play a major role. If we talk about many diseases like cancer, rheumatoid arthritis, diabetes, so it's happening all over the world, right? So not in India or Malaysia or Egypt or another country. So every country we are facing many disease and disorders, right? So if something happening in one country, if we want to connect the data, so artificial intelligence, nothing else, this is a computerized system which basically we are going to diagnosis. We are analyzing the data of the different disease and disorders, or maybe different diagnostic techniques also. So as far as my thinking is concerned, AI is playing a really significant role in healthcare industries. If we talk about the cancers, so there are many things involved in the cancers, like cancer is the abnormal growth of the cells. So if simply we are not able to see that particular abnormal growth of the cells by visual effect, that's why that's going in our different sectors and different domain and all. So we have latest technology, like if we talk about the MRI and robotic surgeries, day by day coming, we are with the new technologies and all. So data integrity and data superficially, we talk about the programming of the different disease and disorder symptoms like etiology, pathophysiology. If we talk about the doctor expertise, definitely they can diagnose the disease. But whatever treatments we are taking for the different disease and disorders, that's we definitely we required lot of data if we want to give opinion about the any disease and disorder, so the customer, the patients can understand what's happening in their body on the basis of that particular data, right? So whatever things coming day by day in healthcare industries, and as we have seen in COVID-19 pandemic, that was the world biggest emergency. We all countries we are connected with the different kind of data set data and all, right? So Dr. Anjum and Dr. Ishtar Mala, I would like to say in COVID-19 pandemic, our pharma industries play a major role. It's just because of AI, right? Generally, if we talk about the drug discovery process is required almost 8 to 10 years, right? If we took that 8 to 10 years for the development of vaccination, hope maybe we are not talking to each other now, right? So that's possible because of AI technology. We are connected, our scientists, our healthcare professionals, doctors, nurses, pharmacy officer, different part of the country, they were connected with the AI tools and all. They have the genomic data of that COVID-19 virus. They have studied in a very short duration of time, and finally, we discovered that particular vaccine in 1.5 years. So that was possible because of AI tools, AI applications, different programming, genomic information. Because if we are developing any kind of vaccine or drugs, we need a target properties. We need to identify what kind of target that was has. So that was easy to understand with the help of these technologies. So I think AI is really playing a major role, and we have to understand the applications as per the current scenario. World is very beautiful, no doubt about it, but our lifestyle is changing day by day. So people are going for a different disorder and disease. So with the help of AI, at least we can be aware about the data set, what kind of things happening for the different kind of disease and disorder. Like if we talk about the major scenario, cancer, so cancer having so many genetic manipulations in all DNA, RNA. So we have different kind of data set and various kind of AI softwares in healthcare industries.
Well, that was really a wonderful answer, and we know that AI, we are using AI. There are a lot of resources that were possible with the help of AI, as you already discussed, especially about the COVID-19.
Yeah.
And if you talk, yeah, it is helping even in the medical imaging applications that we talk
Yes,
about, like
absolutely.
an MRI. You have already talked about
MRI,
that.
CT scan, yeah,
Yeah,
very.
even it is making the procedures easier. The diagnosis part, with it is being made easier with that. And AI is also assisting in the personalized treatment planning by analyzing the data of the patient and the
Absolutely.
medical literature that is there, and it is leading to improved decision making, we can say. And
Absolutely.
AI is also streamlining the administrative tasks. It is reducing the burden of healthcare staff, and it is improving efficiency. So here I would like to ask one more question over here, because when we talk about AI, everywhere the people are somewhere scared that AI will replace humans. If it,
Yeah.
like I'm from education field, so here we are in a fear sometimes that AI will replace the teachers. With the people who are working in industries, they are also scared that AI will replace the manpower. So if we talk about healthcare, so what do you think? Will AI replace human healthcare providers?
Yeah, definitely is a very good questions from Dr. Anjum. I agree on that point. The people have so much like anger about all these things that AI can replace the human, right? So I am completely disagree with that point. Definitely, AI can have some kind of technology. Everyone must be aware about the technology, whatever we are doing, because world having so much population, so definitely we need a manpower. But if we talk about the healthcare industries, so we need expertise in terms of doctors, nurses, pharmacy officers, technicians, and all. Right? AI can give something about the data and all. If we will not do the research, AI cannot make the drugs. Right? AI cannot make the formulation. AI cannot make the tablet, capsule, syrup, and all in all. Definitely, with the help of AI, we are going for the automation in the industries. We are seeing, as you told, that we are seeing a lot of advances in the different types of diagnostic tools like MRI, CT scan, endoscopy, and all. So, with the help of technology, we are able to identify the problems, right? But we are not able to make the drugs, medicines, and all with the help of like AI tools and all, right? But the set of data already, if researchers, scientists are doing different kind of research in the different kind of disease and disorder to identify the target and all, so that particular data can save the money as well as the time, right? If we are not updating with the technology, definitely everyone will face the issues in the industry. uh, if we talk about the pharmaceutical industry or maybe healthcare industries or maybe in everywhere, we are now seeing the applications of AI, chat GPT, and all. There are many tools coming day by day. So, as far as my thinking is concerned, as we are dealing with the healthcare sector, we need expertise. We need support of nurses, doctors, pharmacy officers, scientists, and then they can make a different kind of domain for the different kind of data sets. Like if we talk about the etiology of cancer, pathophysiology of cancer, stages of cancer, what you will feel, what you will observe in the different stages of the cancers and all. So AI can give something pinpoint, maybe alarm indicators to you that you are in the stage of first or second in the different kind of disease. So AI can give a better solution, and you can protect yourself from upcoming, what we can say, the severity of that particular disease and disorder. So AI can definitely reduce the number of manpower, but those who are having good skills, having updated with the technology, they don't have any kind of issues, and they don't worry about the their significance in the research in healthcare industries. So I think I would say on this platform, everyone must be updated with the technology. AI is just a programming tools, right? Whatever data we are putting in computer applications, on that basis, that AI can give the results, right? But if we talk about the integrity, our opinion of the expertise from the doctors, pharmacy officers, so definitely we need some experts of the different field. So if we talk about the technology, so technology is always a good things because we are surrounding by the large number of population as we are seeing in the different countries. So if we want to communicate, everybody is not going to clinic for some kind of things, but if they are connected with the technology, they can see their reports. Even doctors, like if we talk about like somebody, some professionals are good in London or maybe Malaysia, maybe in Egypt, Philippines, and all, right? If we want to connect with them, just we have to share the data with the help of AI to that particular doctors or a physician. They can guide us like what we are talking here, right? What we are discussing here, that will be maybe go live and everyone will see. So what's happening nowadays, pupils, those who are lazy, those who are not able to understand the significance of technology, they generally give excuse, oh my god, AI can replace us, what we will do after if AI will be implemented in the future. So I think so we must use this technology in a good way. Everything has some kind of merit and demerits. If we are using AI in healthcare, because healthcare industry is very sophisticated and so much like what we can say, having minor things, and we have to monitor the severity of the disease and all. So definitely we must work on the integrity of that data, and we must look forward for the safety of that data, because that is related to the adverse effect of medicines, side effect of medicines, right? So, being a pharmacy, we are the species of medicine. We know what can be the side effect, what can be the adverse effect, and what can be the drug interaction also. I'm giving simple example, Dr. Anjum. We have some toxicology lab in our college, and we are seeing the drug-drug interactions possibility. So we have made one software with the help of AI tools, right? So if we have prescriptions of any patient, and if we want to check the drug-drug interaction or drug-food interaction, simply we have to put these two drugs in that particular software. That software will give immediately result within a second. Are you taking right medicines or not? Is there any drug interaction or drug-food interaction? Is not. So that will be good for your health, right? So, Vicky, doctors cannot remember all these things on a single time when he is prescribing the medicine, because it's a human error, right? But computer cannot give an error if something we are putting in a good way, right? So that basically we need from the AI. Yeah.
Yeah, maybe you can put your phone on silent mode, doctor.
Yeah. Please. Yeah.
Okay, today I just read one of my Facebook friends just put a notice there. He said artificial intelligence is so fake, and there's group of people supporting. Uh, of course, if you don't know how to appreciate the technology, you only see the bad part of it. Yes, people are abusing AI, and there's a lot of evil things happening, bad things, negative things are happening. But again, let's see how AI is supporting, contributing to our daily life, especially in healthcare. Like what you say, doctors cannot remember everything. You see, if we go like that, there'll be very primitive way of doing things, and it will slow down the process, right? If we have AI which can take care of most of it, then it's very easy. In a press of a button, you get every information. No,
Sure.
even for the nurses will be very much easier, right? To check, what this patient supposed to take, what is the right medicine, or if they are giving any wrong medicine. Everything is possible now with AI. Please
Yes,
carry on.
absolutely.
Carry on. Yeah,
Yeah,
wonderful.
Dr.
Please carry on.
Istamana, definitely you said in a very good thing. I would but like to add something, as I previously also read in our session. We are seeing a lot of things. Like if we talk about the diabetes, now you can see glucometer, right? You may
Yeah.
keep that glucometer in home. There is no need to go in a clinic. Just we have to
Yes.
take the blood and put that on glucometer. You will find your readings, and then you can put on the software. So doctor
Yes.
can see your daily reports, what kind of sugar levels you are following. So if that is going above the range, indicators will come to you. No, you are going and above the range. So that kind of benefits we are getting day by day in our routine life. But even you can see the facilities now. There are many websites, many telemedicines, many
Yeah,
modern
we
technology
really
that
don't
is
have
available.
to go there to see the doctor.
Right.
Online doctors, they can monitor us
Yes.
and, save their time, save costs and
In
everything.
COVID-19 pandemic, we have taken almost online consultants from the
Yeah,
doctors, right? So that was the
yes,
biggest advantage of AI tools and all, right? Yeah.
yes, exactly, exactly. Thank you. Yeah,
Yeah.
carry on, Dr. Anju,
Yeah.
please.
Can we have the next slide? Yes, of course, as you said, when we are using this AI, the first thing, of course, when I asked, like, will AI replace human beings in healthcare system? Like any other field, because we need to upgrade ourselves along with the technology, because the
Definitely.
doctors cannot remember everything, as you said. And of course it will be very easier not only for the doctors but also the other healthcare staff to manage the patient's data, because everywhere we need to know, and as you were talking about, it is called as remote healthcare or tele medicines system that have been developed with the help of AI, and we are combining it IoT to collect the data. So everywhere, if we see, of course, like on the slide, we have the benefits of AI in healthcare, which helps in enhanced diagnostic and the personalized
Yeah.
treatment plans, predictive analytics for patient outcomes, and efficient healthcare operations. So when we look carefully at the personalized treatment plan. So here we need a lot of data of the patient. Like you were given an example of glucometer, where being
Yeah.
at home, if you just update the data of the sugar level, the doctor knows it. And even the predictive analytics, we can also predict like if so and so is the blood pressure level of a patient. So what can happen, and the doctor can prescribe. So everywhere, if you see, we are having this data, and especially when we talk about AI, we are using machine learning algorithms for analytics. We are using the classification feature of machine learning. So AI, when we are working with AI in healthcare, again a lot of data is being used. So when this
Yeah, again,
healthcare
another
data is
thing.
used, this is
Yeah, Dr.
another
Anju,
question. Yeah.
another, sorry to interrupt. There's another important thing is that we must also understand that doctors are human beings, and
Yep.
a
Yes.
number of patients is really increasing
Day by day.
rapidly everywhere,
Yes.
everywhere, all over the world, even now. You see, so doctors need rest to be to treat the patient. If we are going to burden all the doctors, like you say in Malaysia, many doctors are leaving the industry because they can't take, especially this young generation, they can't take the pressure.
Right.
So, they are leaving the industry. So, with AI here, doctors can perform better, the nurses can perform better.
Right.
So, and we can get more accurate, results, you know, and a lot more things. Yeah. Please carry on, Dr. Anjum. I know you got a lot to share.
Yeah,
Sorry.
of course, the performance of the doctors and the all the healthcare staff can improve. But as I was talking about data, and my research work is little bit, when I am working in IoT AI, but I am also working on the security concerns of this.
Right.
So now I would like to ask, like when we are using AI in healthcare, so how much AI will ensure data security and privacy?
Uh, yes. So, Dr. Anchum, I would say something about this. If we talk about the safety and security of data, there are many authentic way, right? If you will search something on Google, Google Devta will give all the informations, right, about anything. But that is the matter of trust, and that is the matter of quality data. So there are many application software in AI. If we talk about the healthcare industry, like we have Stigma for the structural installations. We have some softwares in pharmaceutical industries like computer-aided drug design, that is CAD. We have QSAR, quantitative structure activity relationships. So we have different data set with those who are having authentic information about the all kind of medicines, all kind of target disease and disorder, right? So if we are following, if we are getting any data, so there are many market research company. They're collecting the data from here and there, but the source must be authentic all the times. Because we are dealing with the healthcare, right? So every one health is very important in the world, right? So as you told Dr. Anjum, that safety of the data is really a very important. So for that, what we have to do, we have to go for the cyber security analysis. We invite some kind of in our Indore, there are some one DGP, Dr. Kapoor, is creating so much awareness about the data safety and cyber crime and all. So I know there are many hackers. They can dilute the data and all from the all kind of data set. But safety, especially in healthcare sector, is very important. If we talk about the pharma industry, those who are making many medicines, they generally give in code of that particular formulation what they are making. They generally not disclose what kind of component that formulation have, Definitely they will display the information on different kind of set of websites. If we talk about the WHO, World Health Organization, so they are giving so many things on which we are working. If we talk about the Pharmacovigilance Center of the India and all over the globe, whatever adverse directions coming from the different kind of disease and disorders using by the doctors, nurses, they are reporting to the healthcare professionals. We have the wonderful system. That particular report comes to the different kind of scientists and regulatory bodies. First they will analyze, they will monitor what kind of information is coming, and then important thing, from which source. So after refining, after verification of the data, they will put on the authentic websites as well as the application software. So this particular things can give something better results. If we talk about the publications, as you are things seeing in the different kind of publications, they are generally named as an international journal of so and so and so. I would like not to mention the name, but if we are giving the name international, that doesn't mean that they have the authenticity or not, right? So if we have to understand what kind of things they have, what kind of policy they have, and how they are publishing the research, how they are giving informations to the healthcare professionals. We have Drug and Disease Information Center in Modern Group of Institution Indore. So we are trying to give unbiased information to all kind of healthcare professionals, right? If someone is promoting their company or their product, they will definitely say my product is best. Nothing can be wrong with my product because that is the product of their company. But if we talk about the unwise in drug information, rational use of medicine, so all over the world, definitely all healthcare professionals must work on that, the safety of the medicines. We have to focus on quality medicines parameters. And as you know, so WHO has given essential medicine list that is using by the most of the healthcare professionals in different kind of disorder and disease by the all kind of informations, right? As we are the pharmacists, we are the pharmacy officers, definitely doctors giving life to patient, but with the help of medicine, right? But we pharmacy officers giving life to medicine. So basically, we are the species of medicine. So this is our responsibility also. We must communicate something good to the doctors, and the same time we have to discuss about the adverse effect of that medicines, so that all the patients can understand the utilization of that things. So ultimately, if we talk about the healthcare system, always we have to discuss about the safety and quality parameters in all aspects, whether if we talk about the diagnostic part, if we talk about the treatment part, different regimen, planning for the patient's recovery and all. So we have lot of set, and everyone is so equivalent. If we talk about pharmacy officers, doctors, nurses, technicians, if suppose pathology is giving wrong results to the doctors, then doctors will give wrong results, wrong treatment to the patients. So ultimately, health will not be improved. So if we are looking for the proper health of the patient, proper recovery of the patient, so everyone must be genuine, everyone must produce an authentic report, so that we can definitely improve our healthcare system with the help of AI. Thank you.
Wow, that is really a wonderful answer because yes, we need authenticity of the data. Can we have one more slide, please? Yeah. Uh, when we talk about data, yes, it is really, really very important, and especially like I was talking about the security and the privacy concerns. When we talk about, we need to protect the sensitive patient information from the unauthorized access and the breaches and ethical considerations. Uh, that arise regarding bias and fairness in algorithms, job displacement, and the necessity of human oversight and accountability. So integration hurdles exist due to the legacy systems, the fragmented data, and the lack of standardized data collection protocols. And if you talk about something about the future of AI, of course, there are emerging technologies. Then we have AI ethics and regulations, and like we were also discussing about the patient data security and privacy and the global impact. And because this AI, it is not that it is being used in one part of the world, even in the developing nations and many other countries, we are using AI applications in even healthcare, and we even don't know. Some of them even don't know that they are actually what the facilities that you are getting in the healthcare system that has been revolutionized. that is somewhere due to AI. Many people even don't know it. So that's why we can say, of course, there's a global impact of AI even in healthcare. So before concluding session, I just have one last question for you. Like, of course, AI is helping in research everywhere. So how AI will help, or how AI will contribute to the research and development of new medical technology? Because yes, healthcare has advanced a lot, but still we are expecting some new, more innovations into that. So how would AI contribute to that?
Yeah, very nice question. And this question is very related to my area of interest because I am the man of research and development. I'm doing a lot of research, especially in pharmaceutical industries, since long. So basically, I have done almost 14 patent, almost 200 research papers. So definitely, I can give better answers for these questions. If we talk about the research and development in any industries or maybe in healthcare and all, which are related to the instrumentation part or maybe the medicine part, drug discovery is very complicated process, right? So it's involved various steps like preclinical and clinical, using animals and human being also for the trials of the medicines and all. So if we talk about the research or research molecule, especially focus on healthcare system, firstly we'll discuss about the drug discovery. So basically, drug discovery is completed in two phases, madam. Preclinical and clinical. Firstly, whatever some compound we are synthesizing or we are taking from the natural resources, as we are seeing the regular use of herbal medicines nowadays. So people have a misconception in the society that herbals are always safe, but I am completely disagree on that point. There are many herbals medicine which can give a lethal effect to the mankind. They may cause many kind of adverse effect or side effect to the body. So that is completely a wrong thing. So we must go for the standardization of the herbal technology. So as you told, as we are discussing since long, that instrumentation part is playing a major role nowadays in drug discovery process. There are many things coming day by day. We talk when I did my PG in 2008. There was very few equipment or machineries those who can make the tablet capsules, and we have to use almost work via the manual way, right? But if we talk about today era and scene, we are seeing a lot of good application, good instrumentation. Simply, if we want to make like 1 lakh tablet in a day, we can make it because that is the need of the hour. Because I already told you that population is increasing day by day in all over the world, so we need sound system definitely. And with the help of AI, we are going to monitor the efficacy and the quality of medicine. There is a one process IPQC, in process quality control, right? In previously what happened, we are putting the product and after finalization we know about it, that is good or bad, right? So that is the completely loss of time as well as the cost of that particular drug discovery. But nowadays in every step we can check the progress, we can check the quality of that product or the machine or the drugs, because we have IPQC tests at different level of set of times, right? So in if we talk about the research and technology, previously research was definitely pupils were dedicated, committed toward the research in previous era. Now, as Dr. Mala said, young generation is leaving the job because of so much pressure, and that is I'm completely agree with Dr. Easter Mala, right? So, but due to advancement of technology, now manual work is very less. All these things we can see in the technology, what's happening as a defect or maybe some kind of abnormalities in the medicine or maybe the operation whatever we are doing in the pharma industry or maybe in healthcare industries. So what's happening nowadays, we are putting this as, for example, I went to the doctors for the treatment or diagnosis of the disease. Pathology can take a blood and they may go for the diagnosis. They can give results up to 2 p.m. or 3 p.m. Doctor said, okay, go to home, we will discuss on phone. Why he's saying or she's saying that, okay, we may discuss? Because he has the data on their computer. He may see anytime with your application code and all. So research is nowadays very advanced. As I have discussed, two software, computer aided drug design. There are many designing softwares now in the market. There is no need to extract all the compounds. Then there is no need to make all the synthetic compound. There are some software they can give predictive results. they may give hypothesis about your determination ki, okay, you have this kind of compound, this will give this kind of activity, maybe anti-diabetic, anti-cancer, anti-malarial and all. So this particular things definitely giving a lot of things, and we are getting so much advantage now. Cost of drug discovery is very less due to advancement of AI implementation in healthcare sector. In the same way, we talk about the duration. Duration is also going to less. As I told you, the preclinical drug discovery is generally takes 5 to 6 years in previous era, and almost in clinical trials we may take around 7 years. So if we are waiting for a one drug discovery and it's just take around 14 years, then you can imagine what will happen with the current era of life. So with the help of technology, now time has been reduced for research, and we are getting so much data from the different kind of software applications. So ultimately, I would say, because I have done my research in that particular era. Recently, we got award in Delhi for my research on cow urine therapy in cancer patients. So that was the research in 2007, and believe me, I have done that this particularly manually. But the paper was published, so someone read my paper and they have invited me for a discussion. So what we are seeing, this is the advantage of technology. If you are in like Malaysia, Egypt, Philippines, and all, but if we are putting some papers on an online mode, on a virtual mode, everyone can understand where we are leading, where our researchers are doing, and you can find out the research gap. There is no need to repeat the research, right? You may discuss on the plate on the different forum as well, and we may find a research gap by reviewing the different kind of research articles, publications. Okay, she has an anti-diabetic activity of that compound, we may go for the diabetic complications. There's no need to repeat. Ultimately, that is the wastage of money as well as wastage of the time, right? So I think so. Research with the help of AI, we are moving so fast, and that is the need of our. We have to use AI again and again. I'm saying AI has a lot of impact, global impact, and that why we are connecting with each other and we are giving some solution to all over the world. But we are talking about the India, Malaysia, or Egypt, Philippines, Canada, and USA, right? So everyone is very much connected with the research foundation, what countries are doing. And that is the biggest advantage, as we have seen in COVID-19 pandemic. A lot of country comes together and finally they made the vaccine, and we all are safe. And we are discussing here about the further advanced technology as AI in healthcare system. Thank you.
Yeah, of course, that is really a very wonderful answer.
Thank you, ma'am.
And we really discussed so many things about how AI is helping in healthcare. We discussed about uh, how it can help and how it can advance the healthcare system, how it can personalize it, how it is going to help the healthcare providers. Especially the last section where we were talking about how AI will contribute to research and development of the new medical technologies. Because when we are integrating AI in healthcare, it marks a significant milestone in the evolution of medical industry and the benefits of AI in healthcare, from enhanced diagnostic to personalized treatment plans. This will just underscore its transformative impact on patient outcomes and operational efficiency. And as of the future of AI in healthcare and promising technologies and ethical considerations, they are going to play a very big role. So
Absolutely.
that was really a very fruitful discussion. Thank you very much for sharing your knowledge, your valuable knowledge, and your valuable time with us on this wonderful platform. Thank you once again.
Thank you so much
Yeah.
for a nice interaction and all. Yes, Dr.
Thank
Ishamala was the
you.
next.
Yeah, thank you, Professor Dr. Nitesh. Thank you. Such a brilliant sharing. And you reiterated to all of us that AI is so important in our life. It's not. No. If we think we don't need AI, then we are going back to Stone Age. We will be cold storage. Yeah.
Right.
Whether you like it or not, you have to call we people will cold storage you, and you are cold storage. You are going to into a cocoon. Yeah. So AI is so crucial. Yes, please do not abuse. Make good use of it. Just like social media. Yeah, social media is not bad.
Mm,
Facebook is not bad. Everything is not bad. Nothing is bad. The wrong use of anything, which is what makes things bad and worse. Yeah, so we are so delighted to have you today, Professor Dr. Nitish.
thank you. Thank you.
We love to have you again with another topic. Just suggest to us when you have any topics, and we will slot you in future. And thank you so much, Dr. Anjum, for your
Yes.
high commitment and wonderful sessions you've been having. Anyway, we are already celebrating our first anniversary. Soon we will
Wow,
have,
great.
yeah, yeah.
Congratulations in advance, ma'am. It's really.
Thank you so much. I owe all the. I mean, I can say I have to extend my gratitude to my team leaders, my project leaders, my advisors, Dr. Anjum and Dr. Rania, for giving me full support, and also to each and every one of the panelists, because without you, we cannot carry on. With your support, we are surviving. Yeah. So let's
Yes.
work together, serve each other, serve the global audience, and be happy. Thank you so much.
Thank
Thank
you. Thank
you.
you so much, Dr. Isher and Dr. Anjum, for a nice and kind interaction. So kind of you. And definitely we will connect for any kind of mission towards empowerment of education all over the world. Thank you so much.
Yeah, thank you so much. Because I think we Indians, we normally say that food and education is the best charity.
Absolutely.
Yes, the best
Yes.
charity you can give anyone, old or
Absolutely.
young, yeah, which money
Yes.
cannot buy. And we are proud to
Absolutely.
present that. We are proud to be part of it. Yeah, there's
Absolutely, ma'am.
no, yeah, we are not involved in many other unpleasant activities online. We are doing something very noble, and we have very good audience continuously supporting us. Yeah, so
Yes.
we will extend more values to everyone. Thank you so much. We'll meet again on Friday on another forum with another topic with Professor Rania. She's having a session now, so she's not able to join us for this forum. We'll meet again with Professor Rania on Friday, and again next week with another interesting panelist to share on our sustainable development goal um, forum. Thank you so much. Thank you for your
Thank you so
support
much,
and all
ma'am.
your comments. Thank you.
Thank you so